So the question of mandates, this is a globally hot topic at the moment. And Australia and the US have been talking about these questions a lot. What I and many of my colleagues believe is that we need regulation. We need requirements that encourage parents to get their children fully vaccinated. But there need to be exemptions for people who don't vaccinate that are hard to get, that are so hard to get that it's almost harder to get the exemptions than to fully vaccinate your child. That means that the late are reminded because they've got that carrot or that stick, but those who are unfortunately not going to vaccinate, no matter what happens, they're entrenched, they still have that outlet valve, that pressure valve. So my position is that yes, we need regulation, yes, we need requirements, they work, they help us get our vaccination rates up, but having difficult to get exemptions is an important component of firm but fair policies. In the end, we want as high vaccination rates as possible, we want disease control. And we think the best way to do that is to focus on all the many reasons that we have outbreaks and that we have low vaccination rates. It's not just about vaccine refusal, it's also about people who struggle to access the services, families who have logistical difficulties getting to vaccines, service delivery, providers who aren't well updated and educated and who don't have the database systems to help them know if the child sitting in front of them is vaccinated or not. All of those things, what we call the multi-component interventions, help us keep vaccination rates high. That's with children. But adults also transmit diseases. So if the intention of a mandate, a strict mandate, is to reduce disease risk, why don't we get proportional about this and focus on adults as well, where there can be vaccination rates as low as 30%, and they are contributing to outbreaks as well. Getting children up to date with their MMR vaccine, adolescents MMR, or adolescents with pertussis whooping cough booster vaccine, travellers to have their measles vaccine. There's a number of groups where they're bringing in this increased risk of outbreaks because they're not up to date as well. So let's focus our attention on all these groups and all the reasons, have firm but fair policies, have requirements, remind the busy, the late parents, but keep that pressure valve for the entrenched objectors.